Hey, YouTube pipe smokers. This video that you're about to see, this interview, is with Gary Wease, and he's one that I got in contact with to have an interview on pipe health and or our personal health when pipe smoking. So I want to say up front, apologize for the video. It's going to cut out a couple of times. We had a storm come through my area and knock out some of our internet access, and it's back up and going, but it was choppy in a couple of places because they're still working on it. So apologies for that. It is on me. It's not on Gary. And I want to thank Gary again for coming on. It was great for him to take some time out of his schedule to do so. So I hope you enjoy it. Um, I know some of you will not agree with everything he said, but it's great to have the perspective from someone who's in the medical field. So take it as you will. I'm really grateful he did chime in and give his advice, along with his wife's advice, who is a dentist as well. So I hope you enjoy.
Okay. All right, guys, welcome back to the Spurgeon Piper. This is Wilson with you, and I'm grateful for today. Finally getting an interview in on a matter that's been brought up a lot, and that is pipe smoking and health. And we either have questions about it ourselves or we have family members, friends ask us, and it can at times plague us. So I wanted to bring in someone who knows far more about it than I do and have a discussion on it. So today I do have on Gary Wease. Gary, am I pronouncing your last name right?
That's correct. Yes.
Got it. Okay. All right. So Gary, again, thank you for coming on today and having this interview. To begin, just introduce yourself, a little bit of your background, and including your profession and your medical background, if you will.
Yeah, sure. As you said, my name's Gary Wease. I'm a trauma surgeon. I've been practicing in Michigan and North Dakota for almost 30 years doing that. I've been a pipe smoker since 13 years old. I guess I'm
Wow.
mostly a pipe collector, part-time pipe smoker now, just because my work schedule doesn't allow me to sit in the office all that much and puff away. I tend to get in trouble when I do
Sure.
that. Don't think I haven't tried though. I bought a pipe tobacco scented candle and put it in my office, and my office manager came back and said, "Hey, it smells like somebody's smoking here." And I go, "Nope, just a pipe smoking candle. Nothing going on here." Didn't go over that well. So
Yeah. Yeah. I bet not. I bet not. So how do you get into pipe smoking itself?
my grandfather, my dad's dad, was a pipe smoker, and when he passed away, he had accumulated, I don't know, 40 or 50 pipes, and my grandmother knew that I liked to hang out with him when he was smoking, so she gifted all of them to me. And I said to my parents at 13, I said, "Well, do you mind if I try smoking one of these?" And my dad and mom said, "No, go ahead," because they were both cigarette smokers, and at least they were reasonable people, and they were the kind of people that said, "Well, I can't really tell you not to do something that I'm doing at home." And it just took off from there.
All right. So you had family influence on that or background, and some people get into it that way. I didn't so much. I guess I've shared it before, but either professors or I think of the Lord of the Rings, and that was a real
Yep.
boom for the pipe tobacco industry. So that was kind of my entryway into it. So do you have, since this is kind of comes into the topic, do you have family members, and I'm sure you have a fellow or those in the medical field that look down upon pipe smoking? Have you had issues with that?
Not really. No. I don't
Okay,
have very
good.
many of my colleagues that smoke. Probably more cigar smokers than pipe smokers. Um, but I mean, that's probably generally true everywhere. There's probably more pure
Sure,
cigar smokers than there are of us. But I've never had anybody be
absolutely.
particularly critical of it, except my wife when I try to do it in the house. But
Sure, of course, of course. So, so then it comes down to the big question, and when most folks get into pipe smoking, or even cigar smokers,
sure.
uh, it's everything comes to mind of the cigarettes industry and the damage that it can cause to the health and for those who are around and secondhand smoking, things like that. So often, what we are first asked or what's assumed is is there's an equivalence between cigarette smoking and pipe smoking. So is there an equivalence? I mean, are they 1-in-1 in ratio? And even kind of a second side on that, would we say there's a difference between pipe smoking and cigar smoking? So how would you handle those?
Well, this is obviously, as I'm sure you know, a really broad and kind of complicated topic. And I think the best way
Sure.
to look at it is to break it down in sections, cover different, areas of the discussion. So I'll make one generalized broad statement. Okay. And we all know this is not a big secret. People who don't smoke in general tend to live longer than people who smoke. Okay. And that's taking into account all forms of tobacco consumption. That's been proven for years. We know that. And the other thing I've noticed, there's some myths out there, right? That say, pipe smoking is safer than cigarettes. Is that really true? And in some ways, yes, in some ways, no. If you compare people who smoke in general, cigarettes, cigars, pipes, to non-smokers, we have a 10 times higher chance of dying of lung cancer and cardiovascular disease than non-smokers. Okay, now that's taking all smokers into consideration, realizing that 85% of smokers are cigarette smokers worldwide. Okay, the vast majority of smokers smoke cigarettes, and the main difference between the common three forms of smoking tobacco, cigars, pipes, and cigarettes, are that most cigarettes smokers inhale, most pipe and tobacco smokers do not. Now, if you look at the difference between cigarette smokers, pipe and cigar smokers, and compare those three things to a lung cancer risk, which is obviously one of the big concerns, is that pipe and cigar smokers definitely have a lower risk than cigarette smokers because of the fact that we don't intentionally inhale our smoke. At least most of us don't.
Right. Right.
Now, we don't eliminate it down to the point of a non-smoker, because unless we're smoking outside all the time in an open environment, there's a certain amount of secondhand smoke that we still breathe in, inadvertently. So it's not zero, but it's definitely less.
Sure.
Now, the other thing that's often brought up, and I can't honestly tell you the mechanism or the role of this, is that we also know that besides lung cancer, heart disease, and cancers of the mouth and tongue and throat, the obvious areas where smoke is involved, smokers also have a higher incidence of colon cancer, of pancreatic cancer, and I think there's one more, and it'll come to me later on. I don't know what the mechanism of those things are, but it's speculated from what I was reading that it has to do with the breakdown products of the nicotine that's absorbed into your system during smoking. And if that's in fact who, people who use nicotine gum or people who vape or whatever are at those same risks. And you can't eliminate those risks that are associated with nicotine, because even if you look at, somebody who holds a cigar between their lips, there's a certain amount of nicotine in the cigar wrapper, which will actually be absorbed into your body, even if you never light the cigar. So nicotine, this thing with smokers. Nicotine in itself has some detrimental effects, and I'm sure you've had friends or you've had people that you've talked to who they're getting ready to have surgery, and I say this to patients all the time: are you a smoker? Why do you care? Well, I care because I'd like for you to quit smoking for a month before and at least a month after surgery. And they all think because I'm worried about what's going to happen to their lung function when they get put to sleep, right? But that rarely is the concern that I have. The thing that nicotine does is it's what we call a vasoconstrictor. Means that it takes the muscle of the wall of your blood vessels and causes it to contract. So it makes the blood vessels, especially the microscopic blood vessels in your body, smaller, so that they don't deliver as much blood and as much oxygen to whatever it is that they go to. All of that vasoconstriction alters wound healing and alters cardiovascular function and things like that. Those are kind of unforeseen health risks that people don't necessarily think about, but they're present in all forms of tobacco use. Now with, we say, geez, certain tobaccos are higher nicotine content than others. Most pipe smokers are familiar with that. What we don't know, though, is a good sized cigar. If you smoke, say, I don't know, a 6-inch 54 ring gauge cigar down to as far as you'd comfortably want to smoke it, that has about as much nicotine as a pack of cigarettes. One cigar does. So they, that they're considerably higher in nicotine content than what we experience in a bowl of pipe tobacco, for sure, even for a smoke of a similar length. So,
gotcha.
The
Interesting.
Would mention is the obvious risk of oral cancer, tongue cancer, lip cancer, salivary glands, all those things that are anywhere between your mouth and the back of your throat. Again, pipe smokers, cigar smokers, cigarette smokers, significantly higher risk than the general population, and really nothing that we can do to prevent that. I mean, we've got to take the smoke in somehow to smoke it, and that's just a risk I think we're all willing to live with. But again, that's related. How much do you smoke? And compared to the amount of cigarettes, I remember my mom and dad when I was a kid, 2-3 packs a day, they were continually smoking. I don't know about yourself, but I think because of the amount of time that it takes for you to smoke a bowl of pipe tobacco or smoke a good cigar, we don't smoke nearly as frequently at least I don't, during the day as if I were a cigarette smoker. Because it's not like you can step out your back door and have a quick pipe. You know what I mean? What are you going to do? Have 3 puffs and go back in? You just can't do that. So
exactly. Yeah.
By nature, we smoke less and probably expose ourselves to less of the risks over an extended period of time. At least that's what I like to think.
Sure.
Makes me feel about it.
Yeah, right. No doubt. Yeah, agreed.
That's sort of
so
my general overview. So, if you've got more additional specific questions, I'd love for you to ask me, because that's just sort of my general thoughts.
Absolutely. Well, and here's the one question that comes to mind. We can say, and we have to be honest and upfront with that, there are, of course, risks with what we're doing. Whether we want to think of, the combustion that's occurring in our mouth with, and all the way through the nicotine and things like that. But we can say, because of the added chemicals in cigarette smoking, there is a difference with health risk. Would that be fair?
Yeah, that would be fair. I think that in general, our cigars and our pipe are a more pure form of tobacco, if you will. There's less additives.
Right.
So at least we're not exposing to those things.
Absolutely. Okay. And I think that's what mainly it comes up in discussions, is for those who they didn't have an uncle or a grandpa or a dad who smoked, or maybe they did, but they didn't have much education on the matter, and they still don't. They see you smoking a pipe or smoking a cigar, and they just hold it in equivalent. And I think that's a lot of times where the frustration is, and the battle is we can be honest with the health risks we're going through, but we would want to step back and say there is a difference in how we practice. As you mentioned, we don't inhale, or we try not to inhale, and what exactly we are smoking is a different substance altogether than a cigarette.
Now, I ask you a question. I don't know.
Go ahead.
I don't know if you noticed this or not, but I mean, my preference in tobacco is mostly strong English and Balkan blends, and obviously they don't have the prettiest room note. And I've actually had people say to me, "How bad? That's horrible for you." I said, "Well, for me." They go, "Anything that smells that bad can't possibly be good for you." But I'm sure if I was smoking vanilla they'd, oh wow, that's marvelous. That's so great.
Yes,
So
no doubt. And I
your choice
imagine,
of tobacco.
yes,
Pardon me.
and I imagine if you and I, if you and I got some kale and dried it and put it in our pipes, that kale's probably not going to smell too great being smoked. So it
Probably.
wait, there's yeah. So there's probably would probably be a false equivalence if that was brought up. Though it can smell quite be quite jarring for those who are not familiar with English blends, no doubt. So we have these risks, we have these issues, and we need to be upfront with them. But what are some things that some parameters we can take to keep healthy or to avoid risks, things like that, whether we're thinking oral health or whatever else?
Yeah, I mean, I think the biggest thing is moderation, right? I think we need to smoke in moderation, just like we need to drink in moderation, and for that matter, exercise in
Right.
moderation. Sort of the key to everything. I mean, I can't think of and my wife's a dentist, so I had
Oh,
asked her about that. That there's anything from a dental standpoint that I could do, or that my associates and friends in the pipe world could do, to decrease our risk of oral cancer, knowing we're going to go ahead and smoke. Is there any brushing regimen, certain amount of rinsing with different materials that would make any difference at all? And she said, absolutely not. She said the best thing you can do is just do it in a limited fashion. And if you do that, you'll have a lower risk than somebody who continuously chain smokes a cigar all day long. So that, with respect to that, that's about the best advice I think that I could have with that.
sure. Absolutely. Absolutely. I did ask some questions with my own dentist, though he's not a pipe smoker, and so he's not gonna he probably won't share as much enjoy or as much biasness with it as maybe some others would. I did ask him what his recommendation was. He first said, of course, as your wife did, moderation. That was his biggest one, and he did recommend for me biotin, or there's Axe, I believe, as well, which are both non-alcoholic mouthwashes. So I'll throw that out there for other folks, just to keep the gums and the mouth tissue and teeth healthy as possible, which doesn't take care of all of the risks, of course, but right, absolutely. So last question I have. So we covered the health. Last question. Oh, go ahead.
I was going to say, the other thing she did mention
ahead.
is that in the course of her practice, she said probably she's diagnosed early mouth cancer, tongue cancer, and things maybe 100 times. And she said that's just during regular dental checkups. So she said one thing that she thought I should mention to you guys is to make sure that people do continue to go for their regular dental checkups, because dentists are trained to pick up on that stuff. And if they saw
yes
an area in your mouth that you might not even know at the time of you're there in the dental chair, to make sure that they keep an eye on that stuff. And I thought that was pretty good advice as well.
Really good. Yes. Yeah. Really good advice. Good point. I'm glad you brought that up. So last question to end with, not dealing with our health. What is your favorite tobaccos to smoke? And you can even include cigars if you're a cigar smoker, but what are some of your favorite blends that you enjoy smoking?
My current favorite blend right now is Pirate Cake.
Okay.
And then
sure.
My second favorite is a blend called Smoking Mixture, and it's made in-house by John's Pipe Shop in Champaign, Illinois. It's a heavy Latakia blend that I started 30 years ago. And that pipe shop's been there probably 50 years now in Champaign. And it's
nice.
probably one of the nicest, strongest going brick and mortars I've ever been in my life. And I'm fortunate my son lives there now, so when I go to visit him, I've always got an excuse to head over and see the guys at the pipe shop. Haven't really smoked a lot of aromatics over the years. I have tried a couple lately, just because people they tend to send you tobacco when they know you're a pipe smoker, and so
right, of course,
give it to you. So I've cracked open a couple of tins of some different aromatics lately just to try something different, but those are my primary two tobaccos that I smoke.
Sure, sure. Excellent, excellent. Well, Gary, thank you again for coming on and doing this. I know it's going to be
Oh,
helpful. Again,
I hope
I
so.
mentioned this.
It is.
A lot of folks ask about this, so it's
Hopefully-
great to give it covered.
Very good. Well, thanks for having me. I appreciate it.
Absolutely. Well, guys, y'all take care. We will talk to y'all next time.
All right. Have a great day.